Okay, guys, ovarian torsion. By definition, ovarian torsion is the intermittent adnexal ovarian rotation around the infundibulopelvic or the suspensory ligament of the ovary. The suspensory ligament of the ovary basically contains the ovarian vessels, the ovarian artery, and the ovarian vein. And so, if the ovary were to rotate and twist around this ligament, it would result in the temporary ovarian vessel occlusion, and that would result in ovarian ischemia. Torsion may be partial or it may be complete. A partial torsion is a temporary occlusion of the ovarian vessels with spontaneous detorsion, but it may progress to complete torsion, which is an irreversible constant occlusion of the ovarian vessels, which can then result in ovarian necrosis, which is pretty bad. So let's take a look at this. This is the ovary right here in the center, and then you have the ovarian ligament on this side, and this is the suspensory ligament right here. It's also known as the infundibulopelvic ligament, and what it contains is the ovarian artery and the ovarian vein, which is not really shown here. So what happens with ovarian torsion is that it basically twists around this ligament, and if it twists, it basically blocks the ovarian artery and its supply to the ovary, and that will increase the risk of ischemia and necrosis of the ovary. When it comes to risk factors, the main risk factor here is an ovarian mass, like ovarian tumors, which will basically cause an irregularity of the ovary, which will increase the risk of it twisting around the suspensory ligament. When it comes to triggers, any sort of physical activity like walking or yoga can increase the risk of ovarian torsion. Moving on to the clinical presentation, it classically presents with a sudden onset, intermittent, severe unilateral, low abdominal pain, and it may be also associated with nausea and vomiting. The pain will classically self-resolve, that is, there will be no symptoms between episodes due to spontaneous adnexal untwisting, and this is in the case of a partial torsion. Pain may be constant in complete torsion, which makes sense. Examination shows a unilateral tender adnexal mass, and this is due to ovarian enlargement. Why is the ovary enlarging? It's because there is ovarian edema. And remember, as I said, the ovarian vessels that are contained within the suspensory ligament, it includes the ovarian vein. And so if the ovarian vein is occluded, you're not removing blood from the ovary, and so it's going to result in edema of the ovary. You're going to have to differentiate ovarian torsion with ectopic pregnancy. First of all, an ectopic pregnancy would have a positive beta HCG pregnancy test. In cases of ovarian torsion, the result would be negative, and the pain is typically diffuse, that is bilateral in ectopic pregnancy, and is usually associated with vaginal bleeding. In cases of ovarian torsion, you have no vaginal bleeding. The pain is classically unilateral, as stated here. Moving on to the diagnosis is clinical in those with classic symptoms. Why? It's because ovarian torsion is an emergency. You would want to intervene before the ovary gets necrosed. An ultrasound, which is not really required for diagnosis, may also be used as a supportive tool, which will show that the ovary will be enlarged with decreased or absent blood flow on Doppler imaging. In younger patients, there may also be an ovarian cyst or mass, and as I said, any sort of irregularity within the ovary will increase the risk of ovarian torsion, and that then will increase the risk of complete torsion. When it comes to management, a diagnostic laparoscopy is required in patients diagnosed with ovarian torsion. And what this will involve is manual detorsion of the ovary and removal of any cysts or masses, because these will increase the risk of recurrence of ovarian torsion. And an oophorectomy may be done if the ovary is necrotic. And that is ovarian torsion.